So what are the contents in this book is there is definitions, terms, methods, techniques, human cell, cellular and tissue changes, infiltration, regeneration, inflammation, infection, wound healing, vascular changes, neoplasms, benign tumors, malignant tumors, carcinoma, SATU, non-invasive breast cancers, disturbance of fluid and electrolyte balance, diseases of respiratory, like tuberculosis, pleural effusion, bronchitis, pneumonia, lung abscess, COPD. So the questions will be this one. So in biochemistry also, the biochemistry, some test, PDI test, dick test, means test, skin test, CSF fluid, body cavity, time studies, X-rays, pathologically they are finding. So this is the historic stuff. So introduction is that pathology is the study of logos. Patho means suffering. Patho means it's a discipline that judges clinical practices, basic science, and even investigational causes of disease as well as underlying mechanism, pathogenesis, Aristotle discipline, science and symptoms of the patient. So pathology is a variety of molecular, microbiology, immunology to understand the biological, structural, functional changes that occur in cells, tissue and organs to render diagnosis and guide therapy. Pathologists identify changes in growth or microscopic appearance, morphology of cells and tissue by and alterations in body fluids such as blood and urine. Traditional discipline is divided into general pathology, systemic pathology, forming focus on fundamental cellular tissue responses, pathological stimuli, while the later examines the particular response of specialized organs. In this book, we will first cover the broad principle of general pathology and then progress to specific diseases processed in individual organs. Mode of acquisition, congenital, acquired, metabolic and degenerative. So there is congenital, then there is genetic and non-genetic. Pathogenic is congenital, genetic and non-genetic. Genetic inherited or spontaneous, non-genetic environmental or accidental. So there is cerebral palsy due to hypoxia at birth. It's accidental. It is also congenital. Rubella associated malformation is environmental. It is non-genetic. So it is also congenital. So these are the acquisition. It is pathological. So in cystic fibrosis, there will be inherited. And in spontaneous, is Down syndrome. So that will be inherited, which is becomes cystic fibrosis. Something is given, spontaneous, Down syndrome, non-genetic, environmental, and accidental. Occurred is inflammation, growth disorders, injury and disorder repair, hemodynamics, disorder immunity, metabolic and degenerative. So acquired is acquired and congenital. So acquired will be inflammation. So in inflammation, this is due to hypoxia. This is to rubella associated is malformation. This is genetic. This is spontaneous, mean during time interval. Rubella associated is environmental. So these all are spontaneous. This is cerebral due to is also non-genetic. Next is acute appendicitis, which is a form of inflammation. Next is inflammation, acute chronic, acute appendicitis, tuberculosis. What is this acquired one? Then inflammation, what happens is acquired. That the pathological is inflammatory. It's acquired due to outside. Acquired means it can be due to environmental factors, disease, outbreak, epidemics. So these are the acquired ones. So in acquired there is inflammation, means activation of antibody, growth disorders like lung cancer, several disorder, benign prostatic hypertension is also a non-neoplastic. Neoplastic means it's a abnormal mass of tissue or neoplastic disease. What is neoplastic disease? So we say there is abnormal mass of tissue as a result of abnormal excessive growth of tissue. So it's the abnormal growth of genetic problem. The process that occurs to produce a neoplasm is called neoplasia. The growth of a neoplasm is uncoordinated with that of normal surrounding tissue and persists in growing abnormally even after integrity is removed. The abnormal growth usually forms a mass which will be called a tumor. So lung cancer is due to abnormal mass growth. So this can be caused due to any growth disorders or genetic problems that could be acquired. Next is injury or disorder. Injury or disorder means it can cause due to trauma or any acquired. So it can due to kinetic force. What is kinetic and chemical? Chemical means chemical, if we take too much aspirin, like in patient in heart MI, if we taking for heart, so what we have, we can have other disease. So it is a kind of acquired, chemical acquired disease. So this is chemical acquired disease. Next is hemodynamics, where there is shock. So what is shock? Shock is a sudden shock is a blow or fright, a sudden upsetting or surprising event or experience. An acute medical condition caused by fall in blood pressure is such as caused by such events. Shock is a medical condition of insufficient. Siri is saying that it is a medical condition of insufficient blood flow to the tissue as a result of problem with the circulatory systems. Initial symptoms of shock may include weakness, tachycardia, hyperventilation, sweating, anxiety, and increased stress. This may be followed by conscious, unconsciousness, or cardiac arrest as complication versus stroke is divided into 4 main types and based on the underlying process: hypovolemic, cardiogenic, obstructive, and destructive shocks. They are saying that ACS shock means there is less oxygen, so hypoxia, which can contribute hemorrhagic shock. Next is occlusive lesion. What is occlusive lesion? So occlusive lesion is a occlusive lesion is a non-carious cervical lesion occlusion and a systemic review of clinical study. What is occlusive lesion? Occlusive lesions. Non-carious cervical lesions are a group of lesions that affect the cervical area of the teeth. So it is affected in the teeth. Different etiological factors have been reported. Among them, tooth brushing force, erosive agent, occlusive force. Aim of the study was to ascertain by means of systemic review the association between NCCL and occursion. Research was found in midline database reviewing a disease article after a title just beginning the clinical investigation were ready in full to select those that evaluated the occupational aspect of NCCL etiologies. This systemic review described the results of three prospective 25 cross-sectional studies. As there is an extreme heterogeneity in design, diagnostic criteria, forms of analysis, and associated factors, a meta-analysis was not possible. A wide variety of classification reflect a high range of reported prevalence and extensive heterogeneity of independent variable was noted. Even in occurrence analysis, which mean to make mass any conclusion about the role of NCC etiology, the literature reveals that study on this topic are subject to substantial amount of bias, such as evaluation used of non-blind examiners and for no control of other etiological factors. Up to now, it is impossible that associated with any special cause agent, the role of occurrence in the pathogenesis of non-cancer cardiac cervical lesion may be yet determined. Therefore, additional study properly destined to diagnose or control. They are saying the occursion is called as deep occursion. So they are in chapter tuberculosis, or tuberculosis is a heterotoxic infection with the most common manifestation in lungs. So it's common, but lesions may also occur in kidney, bones, lymph nodes, meninges, and be disseminated throughout the body, caused by mycobacterium tuberculosis. It is caused by mycobacterium tuberculosis. The infection may cause clinical disease either shortly after inoculation, primary TB after a period of months or decade of dormancy, reinfection TB, etiopathogenesis. The tubercular bacilli gain entrance to the body by several routes. So how the etiopathogenesis is that there is granulomas from mycobacterium tuberculosis. So pathogenesis, inhalation, ingestion, or inoculation. So inhalation of lungs, we can pass through the lungs. Ingestion, it can be to gastrointestinal tract. Inflammatory response is there. Inflammatory response is that the bacilli remain viable with macrophages for extended period. Spread to bloodstream and lymph nodes. So what happens is first that in tuberculosis pathogenesis is that the inhalation or ingestion or inoculation can cause inflammatory reactions. So bacilli remain viable with macrophages for extended period. Macrophages will say the main macrophages were extremely spread to bloodstream and lymph nodes. Tissue reaction develop, formation of granulomas and caseous lesions. So tuberculosis pathogenesis is that tuberculosis first in ingestion inoculation. These are the types passed. After that, inflammatory response, bacilli remain viable with macrophages for extended period. Spread to bloodstream and lymph nodes. It is after that it is then spread to lymph nodes, and then tissue reaction develops. Post tissue reaction develops. Spread to bloodstream and lymph nodes. Formation of granulomas and caseous lesions. Post spread to the bloodstream and lymph nodes. Tissue reaction develops. Formation of granulomas and caseous lesions. Post defense failed. Chronic staging by resolution, fibrosis, calcification. So what happened is that firstly there will be inoculation, skin passing, inhalation, injection. So that there will be inflammatory response, inflammation. Then the bacilli remain viable with macrophages for extended period. So the bacilli will have extended period of macrophage attack, spread to bloodstream and lymph nodes. So there will be bloodstream spreading to bloodstream and lymph nodes. Tissue reaction develops. So after that there will be spread to bloodstream and lymph nodes. Lymph nodes is everywhere. Tissue reaction develops. Formation of granulomas and caseous lesions. Spread to bloodstream, lymph nodes. Tissue reaction develops. So inhalation, inflammatory reaction, bacilli is viable with macrophage spread to other bloodstream lymph nodes. Tissue reaction develops. After that, tissue reaction gradually develops. Formation of granulomas. So how this it is spread? Mycobacterium, tuberculosis. So after that, the bacilli is viable spread to bloodstream lymph nodes. Tissue reaction develops. So after that, there is a tissue reaction. So after that, there will be formation of lesions and the granulomas in the body. After that, there will be host cell defense fail, healing the resolution. Another one, healing the resolution. Fibrosis, calcification, chronic stage. That's about chronic stage. you studying?
etiologically.
Yes, that's the one. Question will look from etiology. First is heart disease. Why? What causes heart disease? Second one is stroke. Second question will be considered is cerebral vascular diseases. Then there is chronic lower respiratory disease. COPD. And fourth one is cancer. Fifth one is COVID. And then sixth one is accidents. Seventh one is Alzheimer's diseases. Dementia. Eighth one is diabetes. Ninth one is tuberculosis.